So, welcome to week two. I mean, week one was a really big, broad overview of many things, and I could have gone so deep in depth, but I know as this course evolves, you're going to be getting a lot more and more in depth with it. We're going to be going over infants, toddlers, preschoolers. So, let's just put this into reality. You're going for a newborn born at 7 pounds who can't lift their head up to preschoolers who are now following commands, talking, walking, skipping, jumping, hopping on a foot, buttoning buttons, etc., dressing. So there's a lot of stuff that goes on in between there. So I think this is probably the hardest part of pediatrics is those developmental stages and when things will happen, especially in that first year. They just uploaded exams for us, so I was able to go in and see all the different questions that were there and, all the variations of them. And there is, quite a bit more on the infant development, knowing the turning over and sitting up and walking and talking. And we're going to go into a lot of that today. Remember also, you're also going to see things like those theorists, all right? So I'm going to be going over them. Those theorists are hard to understand. I'm going to be uploading some worksheets. I do have another professor who just started last quarter and she's new into teaching and very enthusiastic and she wants to help her students succeed. And she's made some worksheets. So I'm going to give them to you too. I said, whatever you give your students, I think that all of pediatrics should be involved with it because I know she's sending it because I've got access to all of her work. So that's why I said, please, it's great, give it to me. So I'll be putting it there, and it's going to help you, especially like the names of those times with each theorist and what are they called, et cetera, et cetera. Anyway, let's go on. We're going to do our PowerPoint first, and we're going to go into our Cahoots. Our Cahoots longer, but you're talking such really key information. There's 59 questions. So let me get through this PowerPoint and we'll go from there. All right. Going to be one of those weeks we're going to be right down to the wire, but I'm going to do the best I can for all of you to make sure that we're not out of here too late, right? So I did send you all of this information first that you can have it. I think it's important. So as I said, what happens in that first year of life, that infancy, remember neonatal's that first 28 days, and then infancy is from 28 days to 1 year old. And there's so much that goes on. You've got a baby who's helpless, can't hold their head, and by 1 year old, they should be attempting to walk, and they've tripled a birth weight, right? So let's look at what happens. Well, we know infancy, there's nothing and no area in our development that grows faster than that first year of life, period. Fastest growing system is, of course, your central nervous system, cognition, thinking. I mean, they go from not understanding how to grab something from a reflex, and now they're building blocks by the end of a year. So it's amazing. And we know that if your environment and nutrition isn't what it should be, these children are not going to grow. The most important thing when we work with children that is all about cognition and growth is nutrition, nutrition, nutrition. If you don't fill that gas tank with gas, it's not going to run, whether it's a car or a human, especially infants. They need, their nutrition. So we know initially they're going to lose up to 10% of their body weight. They're soaking in amniotic fluid and then they lose it. And then all of a sudden, after that, they start gaining between 5 to 7 ounces a week. We double the birth weight by 6 months and triple by 1 year. For the first 6 months, they gain 1 inch per month. So in 6 months, they've gone up 6 inches. I mean, when does that happen again in our life, right? And we go in these, I get pudgier, those plateaus. I call them the step stairs, what they do. They get pudgier then they get taller, right? They get pudgier and taller all throughout childhood. Now, as they get older, the vital signs, the numbers will come down. As I said, at birth, the neonate heart rate 140 to 160, respiratory rate 40 to 60, all of a sudden goes to, at 1 year, maybe 120, 100 heart rate, respiratory rate 30 to 40. And as they get older, it gets lower and lower, and the blood pressure actually does opposite, goes higher. At birth, 60 over 40 is a beautiful blood pressure on a newborn. And of course, it goes to the 120 over 80 as adults. Now, when babies are born, they're born with all of mommy's good stuff: mom's immune system, the iron, and all of her hemoglobin, right? Now, babies don't start making their own cells till about 4 to 6 months, which means hemoglobin hematocrit going to come down. Their immune system that mom gave is going to go away. And that's why what? 2, 4, 6 months we give how many immunizations to get rid of those horrible diseases, right? So, what do we see with all of that? Well, number one, the immune system is going to diminish. We're going to see more sicknesses, but our hemoglobin is also going to disappear. And they go into what we call a physiologic sort of anemia, only because they're not making their cells yet. And this is why we give iron fortified formula and iron fortified cereals around 5 to 6 months when we start to feed them, right? Because mom's hemoglobin carries the iron, right, is gone. So now we have to replace it, replace it, replace it. Now at birth, they've got two soft spots: the front of their head, their anterior, and then there's one in the back, posterior. Fontanelles are called, soft spots. And you're like, oh, don't touch them, don't touch them. And yes, it is their brain, that is there. But um, the one in the back, about 6 to 8 weeks, goes away. It's gone, normal. So why do we need to know that? Well, what if it doesn't close, right? If we check and it's still open, we need to investigate why. Is there, hydrocephalus, brain tumor? What's going on? Something's wrong. Also, the anterior fontanelle, usually by 18 months, is now closed. Well, what if it closes at 6 months? Well, that creates another problem. The brain's still growing, right? So we need to investigate it. And conversely, if it's still open at 18 months, we need to do investigation again. So knowing those numbers are important. And remember, it's a little, more or a little bit less. They're not exacting numbers because all children are different. We know that they can hear, we know that they can see, but remember, at this point, at birth, infants are cooing and crying, right? And visually, they look out of each eye and they don't work together yet. It's called a binocularity, it's called, which means there's no depth perception because the eyes work independently. That's about 6, 9 months. It's all better by then. As I said, initially, it's all about the central nervous system and it's feeding it and giving it proper nutrition so you grow and you learn. Okay, it's not just the growth. Remember, we're feeding the brain to learn. At birth, children don't even know how to suck and swallow and breathe. It's something they're learning from birth. So they have to learn how to grab mommy's arm and take the rattle and shake it and then put their thumb in their mouth. These are all learning things they do. So again, at birth, babies do things like this vernix, it's called. It's cheese. I call it cheese. Not every infant has cheese on it, but they think it is part of an immune system that it's born with. Okay, it protects them. And again, mommy at birth gives so much to the baby, and to continue that, that's why we breastfeed. That's why we encourage breastfeeding, because as mom is producing milk, she's also, let's say she's fighting a cold or has been exposed, or her antibody she has, she's going to pass that through her milk for her infant. Okay. And then We know infants, it's about 9 months, they start making their own immune system. Now, a big thing at birth is their thermal regulation. What do we do at birth with an infant? We take it away from mom and put it underneath a heated, already beeping and screaming in the corner, radiant warmer, right? Why? They're wet. So, what do we need to do? We need to dry this child immediately with a nice warm blanket, put it underneath the warmer so we keep him warm. Why do we want to keep an infant warm? Well, when they start getting lower temperatures, they actually have bradycardia. Now, I learned this by one of those happenstance. I was in the newborn ICU working. I did a bath on a smaller infant, and when I was done, it was all neat and clean and whatever and fixed everything. I forgot to turn the warmer on. And all of a sudden, I look up and the monitor shows the heart rate was coming down. And I look up and the warmer's off, and I'm like, "Oh, that's it." So I learned a lesson that I'm sharing with you. And as nurses, that's what we should be doing, sharing those things that happen to us that we don't want you to do, also, right? I mean, the baby wasn't in harm, it didn't go heart rate that low, but instead of 140, it was 100. There's a problem with that because it should be higher. So I warmed the baby up slowly, etc. Again, remember at birth, the baby has all of that fluid that they've been soaking in. So they have all this extracellular fluid there. And again, what do we do with babies at birth? Keep them warm. We don't have to overdress them as they get older because then they can mature themselves, their own temperature. But at birth, they do need us to be very careful. The kidneys are immature, and adults, we know 30 mLs per hour is minimum, right? Well, in children, it's always milligrams per kilograms. Well, it's mLs per kilogram per hour a year. So it's a half an ml per kilogram per hour. And if we know that we're not doing having that or less, we know that there's something wrong with the kidneys and it's something to look at. We would monitor what? BUN creatinine, right? See what's going on or find out. Maybe it's an immature kidney, maybe they don't have kidneys. You don't know at birth many times. At birth, their GI system is immature. This is why we don't feed them at birth. You know, I had a pediatrician with my young kids, and at 2 months old, he had me feeding them. But looking back, I always saw the food in their stool. He's like, "No, no, no, they need it. Go ahead, give it to them." But, this was an old-fashioned pediatrician. This is 40 years ago, my son is. So it was a while. And they realized that why would you want to have a baby take their time, energy, and burning calories eating food that's not doing any good for them, right? So that's why iron fortified formula or breast milk till 6 months old. I even know after 6 months, when we start introducing foods to these infants, you're going to see sometimes pieces of corn or pieces of peas or carrots or stuff in it. You still will see it. Now, the baby's getting good nutrition as long as they're gaining weight, right? But you're still, the GI system is immature. It's better than it was at birth. So fine motor, remember F is finger, fine. What should you see with a normal, healthy newborn? Well, initially, they're going to be taking mom's finger, usually, and by reflex, they're going to grasp it. And that's called a reflex palmar, because it's the palm of the hand grasp. And then you put a rattle in front of them, they're going to grasp themselves. And then what do? They bring it to the mouth and they put it in their mouth, right? Because everything goes into the mouth. Once they get over the grasping with Palmer, then at 6 months old, we're going to sit them in the high chair, right? And we usually put some puffs or something there just because we think we should. And then the kid goes and sort of smushes it with their fingers and sort of gets it in their mouth. That's what we call a crude pincer grasp. And then they get older and they can take one at a time, right? and that's a fine pincer grasp. Now, that's about by 10 months old. They should do that. At 8 months, 7 months old, it's really crude. Then they should be able to take objects out of containers about 11 months old. And by 1 years old, 2 blocks, they should be able to build. Now, that might be 3 or 4. I mean, all kids are different. I think Christian, my last grandson who lived with me, he was doing blocks of 3 or 4 at that time. I was like, oh, look, he's ahead. Well, he didn't walk till he's 15 months. So we'll continue. Now, this is just a little test for you on what I just said. Gross motor, and remember, when you are getting questions on fine or gross motor development, know what you're answering. Is it F fingers, fine, or is it get up and go, go movement, gross motor, right? Go, 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 like Paw Patrol, gross motor. It's the head comes up first. They should have their head up by about 2 to 3 months. About 5 months, they should be able to go from their abdomen and flip over to their backs. And then by 6 months, back onto their belly. And then you're going to see them try to get up on their knees and they start crawling backwards, right? Then, about 8 months old, they should be able to sit unsupported. And then they should be able to go from their back up onto the sitting position about 10 months old. At 9 months, they're holding on to furniture, walking around, right? They call it that, the creeping. And then finally, about 12 months old, that movement will be the attempt to walk. Now, it doesn't mean a kid doesn't start walking at 7, 8 months. There are kids who do that. And then, like my kids, even my grandkid, you never saw them walk till they're 15 months old, but they did everything else. So there wasn't a concern with it. But you see why we know these developmental milestones. They're important. Now, this picture to the right up top, that baby holding the head back, that is called a head lag. So if I told you they should have head control by 2 to 3 months, that kid should look like the picture underneath. They should hold it up by 3 months. And if by after that the head's lagging back, guess what? They're not where they need to be. Neurologically, something is going wrong. And in pediatrics, and when we talk about it, it's understanding those things that you can make a decision. Is this right? Is this bad? Is this something we need to change or investigate? And what do we need to do with it? As I said, the first 6 months is iron fortified formula or breast milk. We know breast milk helps with so many things. I mean, at birth, if they're a meconium baby, breast milk will help them stool because we know that breast milk, they have a lot more stools. They just do. And with meconium, it's getting it out of their system. When you see like those high bilirubin levels, they turn jaundiced at birth. ABO compatibilities happen. Well, the way that we get rid of bilirubin is through making them stool. So breast milk, again, has been proven it can help also with hyperbilirubinemia. Now, after 6 months old, we can add whole milk at 1 year. So at 1 years old, now the kid's getting whole milk with that extra fat because they need it for their central nervous system, okay? Now, I mentioned this already that at birth weight, they're going to lose weight. And, this does really make some parents upset, especially if you have a child who's breastfeeding. They're like, I don't know, they've lost weight. Maybe I'm not doing something right. Well, as long as they're having 6 to 8 wet diapers, we know that they're getting enough intake, right? And that's what we need to stress. And of course, we're going to give vitamin D to breastfed babies. They need it for their muscle developments. Now, nutrition. We're going to start it. Some books say 4 months, 6 months, but usually rule of thumb at 6 months, we add on, foods. The first food that we should give is actually rice cereal. And rice cereal, why? Again, it's iron fortified rice cereal. It's the least allergenic of all the foods. So we start with that one. And after that, we add on, one at a time, waiting 4 to 7 days in between, making sure they're not allergic from it. Also, when we start feeding infants, this is at that 6 month stage, we feed them foods before we give them breast or milk. Because if they're already full on milk, they're not going to eat food, right? And at this point, they're eating more and more and more, and they need that food. Now, dental health, usually you get babies, they say at 6 months, they should get their first tooth. Usually. It doesn't mean they all do. And again, I'll tell you, Christian, my children never got any teeth at 12 months. At 15 months, they got six. So, it happens that way. And you could sort of feel them that they were coming. We had the dentist look. He goes, no, they're there. They'll come when they're going to come. But usually, let's say if you're 10 months old, you'd say 10 months minus six, they should have about four teeth. That's the rule that they show, but doesn't mean it's always going to be that way. Fluoride can be introduced if it's not, in the water supply, etc., at 6 months old. We don't use toothpaste. We just use a nice soft toothbrush, even a warm washcloth, just rinsing off the teeth before bed, because in bed there should be no milk, no fruit juice, no nothing. They could choke on their own bottles, and we don't want that, okay? They shouldn't be able to prop their bottles. And the reason why, and it's hard if you have multiple births, but it lets the milk sit there, and that milk has carbohydrates and it will rot their teeth. Okay. It does happen. Sleeping, we know they're going to sleep a lot. As neonates, as infants, they'll sleep slightly less. And then they get to toddlers and preschoolers, you'll see less and less. And we know that they're going to be taking naps. We know breastfed babies usually only sleep, if you're lucky, 2 to 3 hours in between feeds. Usually, formula fed babies will go further. The formula sticker, I don't know about it. Um, I just know that even with me, I've watched it being a nurse forever, working with babies forever. Breastfed babies, they want it more often, and we give it to them. And then the other children on formulas, because it's the mother's choice, whatever they want, they do tend to sleep longer. They're saying that walkers and swings and all that stuff is not necessary. Oh, I left my kids in all of them. I think it's a personal choice. They just say it's not necessary, but it's cute to have that swing there. We just think the kid's swinging, looking around, falling asleep. We think it helps with gas, whatever. But the book says it's not needed. There's a whole bunch of immunizations that we give. We know hepatitis B is the first in the hospital, usually, okay? Remember, we give it in the vastus lateralis, the upper outer thigh. We don't give it anywhere else. Even the vitamin K, upper outer thigh, we give it. And we don't give influenza till 6 months old. So and then measles are at 15 months and chickenpox. There are a lot of them. What do you need to know? You need to know the live vaccine, and that is your varicella. So you have to be careful with administering that, immunosuppressed children. And remember, for your med surge class, if they're on steroids, you're immunosuppressed, no live vaccines. Okay. Colic is a big thing where kids for the first 4 to 6 months don't sleep. The kids are always crying. They always need to be picked up. The parents are exhausted. And it's something that they'll just have to outgrow. They can give them all sorts of meds, et cetera, but it's a hard time on parents. And I think sometimes nurses just saying, wow, you've really been through a lot with this child. It's okay. It's going to go away soon. Just give him some encouragement because you have this baby and you think it's going to be wonderful, and the baby cries and cries, and you're not sleeping and you're working and you're taking care of house and the baby's crying, right? Very difficult. Another thing that we have is something called failure to thrive. Now, when would we know if a kid was a failure to thrive? Well, they're not gaining the weight they should. What did I tell you every visit we do for a child? All pediatrics, height and weight, every visit, whether in pediatrician office, urgent care, ER, height and weight. And what do we do with that information? Well, we see, are they gaining weight? Have they gained double birth weight at 6 months? And if they haven't, what have we done to help them catch up, right? And what if they haven't gained 3 times their birth weight at 1 year? What have we done to help them? We can increase calories, we can add so many things. So it's something to be looked at. Now, sometimes failure to thrive isn't just as easy as giving them extra feeds, extra foods, extra nutrition, whatever. There's something metabolic, something's going on. So it does need to have a, checkup, a workup to figure it out because there are some metabolic problems where children just don't metabolize their food and it's not used and therefore they don't have that food and they're not gaining weight. Couple things that can happen for kids is, today, let's talk about SIDS, right? What does SIDS talk about? Being on your back, laying supine, not on their sides, not on their tummies or prone. That prone babies will tend to go to sleep and die in their sleep, right? This is up to 1 years old. And one of the things that we're seeing is the flat heads in the back. Now, infants have soft, soft skulls. Have you ever noticed that? They're nice and soft. And then you've got the soft spots there, which make it mold a little more. And you're always going to have the parent say, well, my kid is a flat head. And then they want to put that right lower helmet on the kid's head to, straighten it out because that's what it's used for when the kids' heads are flat on one side or back. But what's the other thing we can do? What do we do with children? We do tummy time, right? Tummy time gets them off their head, and they're so soft, these skulls, they'll round out and that flatness will go away. So it's just going to take a parent time to do that. Another thing is diaper rash. Diaper rash could be do my kids, they could not wear Huggies. Hated it. Put one on and it would look like that in 1 day. So only Pampers and even cheap Publix brand down here is what I use, the supermarket brand. And they were fine. Huggies, big bad dermatitis. It could be due to the creams, the ointment, could be the shampoos, the soaps, lotions, all of that stuff can cause it. And another thing that can cause it is when we get to start to feed them. When you start to see rashing because you're introducing foods, that could be showing the allergy. Now, that is something, these rashes, especially looking like that can make a kid at night, what's going to happen? They're going to cry once they urinate or stool, right? It burns. So they're actually saying, leave the diaper off at night. I mean, you put a big chuck on the bottom, something to absorb whatever, but to keep that urine off of them, at night. But, I don't know if I'd want that. At least I'd be up a couple times, right? Checking that diaper. It could be due to yeast, which is heat, and there's creams and lotions, etc. for that. Some babies are born and they have that crusty head, right? And I know that, you like to put little bows on little girls and little boys have their hair combed over really cute. And, they've got these crusty heads. What do they recommend to treat that? It's just wash the kid normally, soap and water, Maybe put some, even they're saying like mineral oil on it overnight and then wash them in the mornings. And that just moisturize it and a fine tooth comb very gently over a period of time. It's not going to go away right away. So the sudden infant death, I've mentioned it just because of the head, but what are some of those risk factors? Well, males are more likely than females, and it's due to sleeping on their bellies. It's due to cigarette smoke in the house, that exposure. And this one here was one of those things, overheating. We're telling you that babies do need extra coverage, thermal regulation, but they don't need a lot of it. Wherever you're comfortable, by 6 months, the baby's comfortable with the same clothing on. So not overheating. If a kid just had an upper respiratory infection, guess what? It's going to cover that nose, mucus. All they can do is suck, swallow, and breathe right now. So it's going to create that maybe the apneic spell. Breastfeeding, you have fewer incidences of SIDS death. So that's another reason why you should breastfeed if possible. Poor socioeconomic conditions, it's too hot, it's too cold, it's not clean, whatever. Immunizations they need to have. What is the air like? And types of mattresses if they're too soft. And there are also those cohabitating things they could talk about, sleeping with the parents. They don't recommend it at all. Another thing that children get is something called an ALT. It's an apparent life-threatening event. It's the baby turned blue and it wasn't breathing, and I pat it and it didn't come back. That's what the parent would say. Well, many times it's reflux is coming up, right? They go through a big workup for it, for making sure the brain's okay, and they go through GI, making sure it's not reflux. And then they'll send them home with what we call an apnea monitor. It's just a Velcro strap right across the nipple line, and it measures respiratory rate and your heart rate. And there's this horrible alarm that goes off. It ear piercing if it goes off. So it does work. Number one, I think it wakes up the infant with the sound, and of course, will wake up the parent to go check the child. So Letitia is breastfed. She's seen in her clinic for a 6-month-old checkup, and the mother tells the nurse that she just began to suck her thumb. What do you think the nurse should do? What's the best nursing intervention? Is this right? Is this wrong? Should she?
I think it's normal.
Absolutely normal. Remember, they explore the world through their mouths. They find their thumbs, they put it in, they self soothe. So leave it. It's fine. They say, though, finger thumb sucking, they should stop before they get their permanent teeth in because it will make it all like bucktooth looking thing. Okay, let's look at some theorists. Okay, here we go. I promised you, here we go. Erickson, infant. What does an infant know? Well, they know if they cry, mom and dad, somebody's coming to get them, and they're picked up, they're changed, they're burped, and they're fed, right? That's trust. That's what Erickson talks about. Their needs are met. There are cases with mistrust. Many times it's homes, there's drugs or alcohol abuse or some sort of, other abuse going on, where the child cries, nobody comes. And they cry and cry and cry. This is a child that you'll see at the hospital, your child never cries. Well, a normal kid does when they want to be fed. A normal child who is soiled and dirty wants to be changed, right? So you'll see those differences there. Trust versus which I get everything I want, mistrust, nobody's listening. Piaget talks about a bunch of different things. Think about learning to do things. Remember, they know nothing. So initially they do that reflex palmar grasp, right? And they're like, oh, there's a rattle. I think I can do the same thing there. And it becomes a voluntary, right? And then we sort of move it around. We hear noises. Ooh, that's cool. And I put it in my mouth. So they're moving it and they're touching it, feeling it, and again, exploring it through their mouth, right? As they get older, pre-operational, they start thinking. They start thinking to get what they want. Have a toddler, young kid, sitting in a high chair, has a sippy cup next to him. Mommy walked away, let's say to go get something else for him to eat. The kid throws a cup on the floor. Why? They know mommy's gonna come pick it up and say, "What are you doing? You shouldn't do that. I'll be right here." Right? They know how to do things, how to make mommy, daddy respond. And then we'll go into concrete and we'll go into formal after that. So, again, as I said, at birth, the initiation is all about what they've learned and these accidental things, and the thumb accidentally goes in the mouth, right? So, again, we get into those secondary circulars. Ever look at a kid, stick your tongue out at them, an infant, a young one, a little 4-month old? You stick your tongue out. All of a sudden, the baby trying to stick it out at you, right? Imitation. They're starting to learn they can do what they're seeing there. And then, of course, their play. And play is the sounds and et cetera, et cetera. We know children. There is this thing that they start very early. They see a toy, and even though it's not in sight, they still know it's around. I mean, even your young children, 6 months old, you take and you hide, let's say they like their rattle, and you hide it behind something on tummy time. They're going to try to get there. They know it's there because they saw you put it there. I can't see it, but I know it's there. I mean, as they get older, they know to wake up in the morning and their toy box hasn't disappeared and it's going to be in the toy box, right? And we're starting to get now these kids, you put them in front of a mirror and they're hitting the mirror, right? And they're starting to look and be very interested in that and climbing up on it and doing all those things and touching. We know that there is separation anxiety. I mean, we see this when they're young. Usually, this is when mommy has to go back to work and has to bring him to daycare, and the baby's screaming and yelling when you give it off to the daycare worker, right? And then you have to leave, and it's called separation anxiety. And there's three different stages of that. Now, as we get older, there'll be differences with it, and we'll go over that too. Stranger fear, they only know who they know when they're young, and they don't want there's very few people babies will go to. They have what we call a stranger fear. And this is right about 8 to 9 months. I mean, I'll start playing peekaboo with an infant at that age and looking over the corner at it and go, "Boo," and then come back, and all of a sudden they'll pick their head up and look at me, and I'll go, "Boo." And then it becomes a game, and now I'm not as much afraid. It's just knowing I can't just go up and pick that child up. I need to do something to calm them down. They're not going to be afraid of me. We know language goes, right? And we know that play goes. It's all about exploring your world. Now, the toddler. I probably think this is my favorite age of children. And I love the saying by Jerry Seinfeld, is having a 2-year-old is like having a blender without a lid, right? You turn on the button, you put them down, and they're everywhere. And you can't keep up with them. They're into everything, under, around, over, and jumping off of everything as they get older. And it's just a part of who they are. Intense environmental exploration. They'll find something that you didn't even know was on the floor, and you'll find it in their mouth usually, right? This is all about me, me, me. Mine, mine, mine. No, 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 no. And they don't want to share and they don't want to play with anybody else but themselves. So, infants gained a lot of weight, toddlers, it slows down. And you'll see them get pudgy and then all of a sudden grow. You'll see them getting pudgy and then grow up. Just what they do. They don't quadruple their birth weight till 2.5 years old. They tripled it at 1 year old, right? It's not till 2.5 do they quadruple. Only 3 inches a year they'll grow. Their head and their chest at birth, we know they have huge heads. And then all of a sudden, about 12, 15 months, their head and their chest should be the same, should be right there now. If it's not, again, there's a problem. Everything's maturing, right? We're starting to be able to be potty trained. We know they've had ear infection, upper respiratories, GI. They've been sick, 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 sick. This is all through toddlers. What do toddlers do normally? Well, many have to either go to some sort of daycare or in a house with other children. And kids, what do they do all day long? They share toys. And what's that sharing toys do? They swap spit all day long and they share all the germs. Now, is that a bad thing? No, not really, because you need to build up these immune system before you get into school. And most toddlers, you'll hear parents say, put them in daycare, and every week I'm going to the doctor. This kid is another something something. It's just that immune system building it up. We know upper respiratories are big and you get a lot of ear infections because they're short, straight, small canals directly from the mucus in the back of the oropharynx right up in eustachian tubes. And that's why you get a lot of ear infections. And we know at some point in this toddlerhood, they're going to be potty trained. They're getting a little bit better. They're moving, right? As they get to 1 to 3 years old of toddlerhood, they go from the waddly walking to be more coordinated, right? And that's the 2 to 3 year old. They're able to throw a ball. I mean, Christian would throw a ball at me and I'd have to move because that kid could whip it past my head. And it really could hurt if you're not careful of it. So get a nice soft ball that they can hold and nothing that was hard. Their visual acuity. Remember I told you babies don't really see well? Well, now they're starting to see well. Their depth perception because their eyes are working together so they can really see more, right? One of the things, as I said, is jumping off of stuff. And one of the things about infants, the toddlers, excuse me, they're all about exploring. They're autonomous, is the word. And that's the word you need to remember for Erickson also. Autonomous is all about myself, egocentrical, all about myself. Okay. They want to do it, leave me alone by myself. That's their world. So, one of the things is to let them try as long as they're not going to injure themselves. You need to let them try. I remember sitting and watching Christian trying to jump from the couch over to the hassock, and I knew it was a far way. And my husband said, let him try. He was better at it than me because I was always protecting the kid, throwing a pillow underneath or something, right? But you gotta let them try, okay? Another thing that happens in toddlerhood is they're eating so good as infants. No, 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 no. It gets a great appetite. And all of a sudden they stop eating so well and they become extremely picky. I call it an anorexia because the amount of food they eat is not much. Now, parents will be very concerned about this. They don't need much food at this time. They need some protein, some carbs, some fats, yes, but they don't need but 1 tablespoon per year of life. So it's not like a lot of food that we think, right? So if a parent is concerned about what they're eating, Make them ask them what they had yesterday to eat. Make a food diary. What did you eat? What did you eat yesterday? And then you can look at it and say, it's actually pretty good, right? And then, of course, toddlers see, hear everything, and they want to feel the environment. It's what they do. So, Erickson talks about all about me, mine. Let me do it. Now, the problem with is they're going around checking out the environment, searching and looking and exploring. And then you got mommy and daddy and grandma over here. Be careful and don't do this and here and let me do it for you. That is the shame and doubt. It's like, why can't I do that? I saw it. Let me try, but somebody's telling me no. Okay? So, autonomous, I want to be myself, but the shame and doubt, I'm telling you, no, you can't do that. Be careful. You're going to be hurt. So, what do they like? They like that routine. They like that, what we call rituals, as in they like to wake up. No, they're going to eat breakfast. They're going to get changed. They're going to play. They're going to take a nap. They want to know what foods they're going to eat. They want those similarities. They want bath time, the same time, bedtime, same routine in bedtime. They love that. And when they don't have that, they're not really happy. And that's why being in a hospital with a toddler, even on vacation with a toddler, is pretty hard. And again, remember, it's all about me, 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 me. They don't really know about sharing at this time. This is parallel play by myself. I can do it. Now, Piaget is all about experimental. It's trying to figure things out. And remember, we build on things. It's first number one, getting that by reflex, that rattle, and then moving the hand, we found out it shaked. And then what can we do with this rattle now? So now we throw it, we grab it, we put it in our mouth, we do all this stuff. It's that active experimentation, figuring things out, and as we get older, we learn to control our situations more, like throwing that sippy cup, having mommy and daddy or whoever come. Oh, nobody was here looking at you eat. Okay, well, throw it on the floor. I'll be there soon. And somebody comes, and that's what they're looking for. Same sort of things. Another slide to describe what I just said. And there's pictures showing you some of those things. Now, I'm not going to go over the concrete operational stage right now. It's school age. I'm going to do that next week when we do school age. I don't want you to confuse what we know right now with Piaget and the younger kids, okay? And it works better that way. But to let you there, of course, there's more. Now, toddlers are starting to learn they have genitalia. Well, why? They're potty training. And when you're potty training, they know mommy sits down and daddy stands up, right? And they know there's a difference. And daddy has what is mommy don't. And again, it's starting to understand. I've always, was taught to use proper names. It's always been the things of your genitals. So Christian to this day knows I have a vagina and he has a penis. And the word doesn't mean anything to him because he's always heard it. So, it's like if he's touching himself, I said, "Does your penis hurt? What's going on?" Like, "No, it just itched." I'm like, "Okay," because you never know with kids, right? Got to figure it out. Again, at this age, toddlers right now, they're starting to know there's boys and there's girls. They just starting to know that. And they're starting that playing mommy and daddy as the older toddler, okay? Again, separation. They know the differences between mommy, daddy, family, and others. They're starting to get that. They're a little bit better with like leaving them somewhere. Okay. And we know that they love to be told, good job, great job, you did good. Their language, they try so hard to talk. Now, at by the age of 1, they should be having, a couple words, daddy, mommy, milk, something, food, not even food. Nana was a great one that I heard from Christian. But just a couple words, not many. As they get toddlers, they're starting to understand more, but they can't express it. They don't know the words to express it. And I know that was just a big frustration, watching, as Christian as he got older, it's like he wants to talk, but he doesn't know what to say. So sometimes it's the patient of the parent sitting with the child saying, so tell me, show me what you're trying to tell me, and I'm telling you, toddlers ages 1 to 3, they really understand a lot more than you really think. And they really want to try. They're trying to feed themselves. I mean, if kids under 2, the spoon might be upside down, backwards, but they're trying to feed themselves, right? And it's the attempt that is the thing. They're playing by themselves for sure. They're trying sometimes as they get a little bit older to put their clothes on. It might be backwards, it might be inside out, might be a dirty pair of shorts or shirt or whatever, but they're trying. And again, this is something it should be rewarded, saying, wow, great job, right? And they're starting to understand other people. I mean, I describe this as, I had this really bad flare in my RA, and my left knee was so bad. I was sitting there packed in 2 big bags of ice. I mean, the pain was really bad. And I know Christian came over to me and he says, Nana, Nana. I'm like, it hurts, Christian. And he looked at me and I showed him, I said, it's my knee, sweetheart. And he leans down and he kisses it. I mean, again, these are things, little toddlers, they're starting to understand. And you don't think so, they understand more than you think. Parallel play is toddlers. What is parallel play? I'm playing, they're playing, these are my toys, there's their toys, they're playing next to each other. Toddler play is parallel, all right? And they love to imitate, dressing up as their favorite characters, et cetera, et cetera. Halloween is the big one, right? And they love to touch. That sensorimotor, their type of play, right? What's it touch like? They like sand and mud and getting into all that cook stuff, paints and finger paints and whatever. Toilet training, this is the, stage where children are taught, that you don't need a diaper. Let's try to get it in the right place. And it's probably one of the most frustrating times for children and for parents. Note that you will get bowel training first. It will happen before they potty train. And we always think it's opposite from that. At least I always did, but it is. First, they do their stool, they can control it, and then it becomes that their urine can. They will be having temper tantrums for whatever reason. We know a lot is bedtime. I don't want to go to bed yet, right? But temper tantrums are something they're going to have. I think the worst ones are like if you're out in a grocery store or something and they fall on the floor, right? And because they want something or you're going too quick or whatever, and they're having a moment, and it's like, what do you need to do with that? Well, they say with temper tantrums to walk away, unless what they're doing can hurt themselves or others, right? You don't want any kid to be hurt because you didn't pay attention to them. And again, remember, no, 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 me do, mine, 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 mine. Yes, McCormack.
Uh, sorry, I must not have heard. I don't know if I heard you if it was on the readings. What's the 3 signs of readiness for toilet training?
Well, what are all three? Um, they first have to be able to hold their urine for 2 hours. I believe they also have to tell you about their stool. And I'm really, right now, my mind is off on the third one. I can look that one up for you.
It's on page 850, it says being aware of their urge to void interest in and motivation to use the toilet, and then being dry for at least 2 hours.
Mhm. And you know, the
Thank you.
motivation's usually when you have an older brother or sister, you know, and they are showing them that they are pleasers. They love to please, 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 please.
All right. Thank you.
Again, oh, you're welcome. No, great question. Thank you. And thank you, Sierra. Regression. Children will be off the bottle, off the pacifier, having potty trained by the end of toddlerhood, but something stressful happens. Like they were sent to the hospital and then separation anxiety, mommy had to go home and leave them there alone. You'll see them regress and they will need a diaper again, or maybe they need a pacifier again. You will see them regress. This is how they deal with stress. It is normal. So these are some things here that goes on. We know that uh, refinement of coordination, and we can go right here on the bottom and look at them. We know that refinement of coordination is 2 to 3 years old. That means that waddly will go to that normal stepping, right? The fine motors, we know fine motor, we get up to blocks of two by about 12 months old, but it could be, again, slightly more than that. And we know by 18 months they're picking up that ball and they're whacking me alongside my head, and Christian did it more than once. So social developments, again, initially, they are one-word sentences, mommy, daddy. Then it goes more words all together. And again, then they're starting to play by themselves, getting their own toys because they can crawl and walk over there now, right? And there's going to be trying to feed or play with themselves, etc. Now, car seats. Car seats are one of those things is they should be rear facing up to the age of 2 years old. They should be snug, the shoulder harnesses on it, and they shouldn't be expired, these car seats. Okay. At two, and this was a question with me and Christian, he still only weighed about 26 pounds at age two. He was a peanut, I mean, most of his life. And they said at two, and because he was normal in every other way, it was the muscular control. So we did turn it around. We waited a little bit more and then we turned him around. Now, preschooler. Ages 3 to 5, 3 to 6. Um, Preschooler is now they're little people, right? We're getting them prepared to get ready to go to school and go off and be on with their lives, right? Um, we need to, as they are getting ready to school, as parents, get them ready. Be positive about learning, reading to them. You know, I think Christian has about 200 books at least in his house, and he's read every one at least once. His mother, firm believer in reading, they read together every night. And now that he is in first grade, he just turned 7 the beginning of this month. He's in first grade gifted, this kid, and he's smart, smart. He's lazy, but he's smart, smart, and they'll sit there and they'll read. And I think a lot of his being so smart is because of mom's enthusiasm towards learning and because of the reading. And they read at least 2 books every night together. It's just their time together. Another thing that gets them ready is that they're doing some other activities with a bunch of kids. So they know how to deal with rooms of kids, right? And if they know about rooms with kids, they'll be able to deal with school. I mean, remember, this is hard. They're separated. And now they have to sit. Especially when they start to get into preschooler, now they have to sit, right? That increased attention span. And they're going to have to speak. They're going to have to tell that teacher or wherever they are, you know, what's going on. They have to be able to express themselves. Again, it's still slow growth. 5 pounds a year, 2.5 to 3 inches. And again, their body systems are all maturing and getting more mature. Their immune system's getting better and better. Running, walking, climbing, jumping is getting a lot better. They're able to, by four, just those fine motors, button a button on a shirt. They're able to draw circles and color in the lines and do letters, etc. So when we talk about Erickson, we talk about a sense of initiative. And that sensitive initiative is doing things. These kids want to please. They are pleasers. They want to help mommy set the table and they want to, do goods. Simple tasks. These kids are great at, whether it's putting their clothes in the hamper or putting their shoes where it belong or putting their dishes in the sink. They want to do those things. They do feel bad when they're not doing what they should. And they're going to feel like they've done something really wrong. They've got this really, really um, overwhelming, oh, I didn't do that. Oh, I'm bad. I should have known how to do that. Also, with Kohlberg, they're talking about wrong and right and moral development, always doing what's right. Because, these kids especially love the praise of doing right. They like to be told that they're good. As I said, it's all about learning, getting ready for school, and having them somewhere which is promoting that socialization. Many kids are in sports or in summer camps or whether it's gymnastics, ballet, or whatever. It's good to get those kids into. In Piaget, they're starting now to be able to play with another kid and understand that other kid. They're playing associative play. So they can play together. It may not have an outcome or a winner, but now they can express themselves and they're understanding others and they're starting to understand differences in peoples also. Their language is getting more, they can express themselves better, and they are always in this magical land of explaining things and playing and flying. If you ever see these two children, at 4 or 5 years old, playing alone, they're talking to themselves in their magical land. Time is not understood. They don't know a clock. They don't know 1 p.m. They know after lunch when the sun comes up tomorrow. I mean, Kristen used to be, so Nana, how long can I stay with you? 3 morning times, which means 3 days where the sun comes up. That's how long you're going to stay with me, or until after we eat dinner. I mean, he understands events. They don't understand time. As I said, Kohlberg's all about right and wrong and understanding it. And they do want to do right. But they're getting to that point. Should I do it anyway? They're starting to think about those consequences. They're getting really, really sneaky now. Girls like moms, girls like daddies, and boys like mommies. That's just what they like. It tends to be that way. They become more modest now. If they're taking a bath, they might say, no, get out. Or if they're in there, going to the bathroom, they close the door. No, I'm having some private time. Christian says, I'm having private time. Can I borrow your phone? He's in there in the bathroom with the phone, like an adult would be. You will see the dressing up of mommy and daddy, girls and boys for sure. And now they're understanding there's differences. The boys and the girls, and especially if mommy or somebody close to them gets pregnant, like, how'd that happen? Well, you don't have to explain the whole thing to them. That needing that constant routine can be flexed a little bit with preschoolers. They don't have to be the same thing all the time, all the time, all the time. They could dress themselves. Again, they're pleasing, as I said. And now they're understanding the religion that's practiced in their family. that is their religion, or Fowler is the theorist, but they're understanding that. And they're understanding what the family expects, what they can't do, and what they can do. They're into that associative play, like I said, no rules yet. They're not old enough to understand it. They can imitate, they can imagine, and dramatic play could be like in a hospital, something goes wrong, they can reenact that, whatever happened that upset them, that made them afraid. They're afraid of being in the dark. I mean, Christian, go turn on the lights. It's okay. Well, there's a boogeyman there. I'm like, well, I haven't seen a boogeyman yet. If you find one, let me know. I want to come in and introduce myself. This is what I tell them. There's lights everywhere. Do not be in the house alone. You go outside and he didn't know, and he'd be screaming, Nana, Papa. You can't find us. Guess what? He'd be running outside. Where'd you go? I couldn't find you. This is as a preschooler. They're worried about, that castration, anything that has to do with blood, with opening wounds. They think their insides are coming out. I mean, that's why this is the age of band-aids, right? A band-aid cures all at this stage. Sex education, again, what do they know you need to find out before you start explaining the whole reproductive system to them? Okay? They ask questions, be honest about it. As I said, to use correct anatomical words, it's a personal choice, whatever your choice is. And this is the age where they'll touch themselves. And what I even told Christian was, you want to touch yourself? It's okay. Go into your bedroom. I don't need to be watching you. Do it by yourself. And something, he never had problem with that. I don't make it a big deal. It's not a big deal. It's normal, but it needs to be private. I don't need to be a part of it. So let's get to the cahoots. Any questions yet? See, Laura, you would have missed this all in a recording. Here we go. Now, I'm going to be doing, starting next week, reviews for exam 1. I am working on a study guide right now, and I will be sending them out by Friday. Hopefully, I'll be done tomorrow. We just, as I said, today got exams, making sure that you have your concepts on that study guide is my goal. So you'll have the times. I believe I'm going to do mine on Wednesdays. Is it Wednesday's 4 o'clock good for you? Or is Tuesday 4 o'clock a good for you? Or is 6 o'clock better? You have to let me know.
What day did you say?
Tuesday, Wednesday, or Tuesday or Wednesday?
Okay.
Or is Friday afternoon good?
Friday works great for me.
Friday, 4 o'clock?
I have clinicals Friday.
Same.
Okay. You see, it's all over because you're from all over the country, so it's hard to fit one. Well, I'll put it up, and again, you'll always get my recordings. Oh, let's get going. There's a few questions here, some concepts. So infant, toddler, and your preschooler. Start out with a multi. Types of play considered to be sense pleasure play, like what those toddlers love doing with their hands. Sense. Sensoromotor, right? So it's all about the touch, the taste, and the movement. But what's a sense? So sand is finger painting and it's mashed potatoes. They'll sit there and smush. I used to love to let my kids sit there when they're done and smush it all over the high chairs. And they just used to love that sort of stuff. Because when they were done, they always went to the bath. That's what I did. The nurse notices white patches in the mouth of an infant that cannot be removed with a tongue blade. What does she do with that? What does that could be? Remember, I can't put everything into one type of PowerPoint. There's going to be little pieces here and there, and I try to throw it into the cahoots. Now, white patches through Spanish is called ungle, or it's thrush. It's a yeast infection, and that you can't scrape it off is the clue. It's not just milk sitting there, and it needs medicine. It needs nystatin liquid, usually swabbed inside the mouth of an infant, okay? What type of play is considered cooperative play? You know, you say cooperate, it's you have to cooperate together for somebody to win, and that's checkers. Okay, that is a classic cooperative play. Or they could say, kids get together, let's build a house together. That still has an ending, it's a finish, it's a result, what you want to do. According to Kohlberg, pre-conventional level of moral development, a preschooler who has moral reasoning, what? What's Kohlberg all about? Kohlberg is all about good and bad and a consequence for each. That is the premise of Kohlberg, okay? It's not all about what you do with those things, it's just understanding there's good and bad. And each of them, I'll get a praise or I'm going to be punished. Which nursing action is appropriate to teach a preschooler, a child, about a scheduled procedure? You have a kid, ages 3 to 6, needs to go get a procedure. How are you going to teach? Because these children need to be taught what's going to happen. They'll be a lot better of a child. And yes, use a doll. And then let them touch the doll, touch the equipment, make it less threatening. And this is all on their developmental level. Okay? A multi. What are some findings from a pediatric physical assessment? A physical assessment. You know, many times quizzes, exams are all about reading the question. A history is a history. Physical is what you touch and see. Growth, body systems, and temperature are all physical, okay? So again, remember, read the question and what does that mean? Before performing a physical assessment on a toddler, the nurse should do what to encourage cooperation? What do you do first? Don't touch the kid initially. Number one, you're going to get down low. You're not going to tower over a child. That's the first thing. Get lower. I like to even get lower than the kid. If they're on a high chair or if they're in a bed, I will go sit on a chair next to them. I'm lower. Then I'm going to get on their level and talk to them on their developmental level. So all minimal at first. Then, as I'm explaining, I'll utilize play and let them touch the equipment. Okay? So first of all, you do nothing. What would you suspect if you note that the infant's chin is quivering, those fists are clenched, and they're inconsolable? What does that mean on an infant? Like that. They're crying. Mommy's holding them. Nothing's happening. They're in pain. That's absolute sign of an infant in pain. It's when you can't console them. If they're banging their head on the bed, like it's the location's probably an ear. Okay. But overall, generally, that is just telling you there's pain. When you look closer, maybe it's the legs are going, maybe it's abdominal something. Gotta look, they'll show you. A multi. Erickson describes infants as trust versus mistrust. What does trust mean? They're happy, they're secure, and they know what's coming. They do not have to cry too long for nothing. That's mistrust. A 3-year-old is having an outpatient procedure. How would you help the child to be less fearful? I mean, there's several questions regarding this because this is the most important thing about working with kids. You could be the best at anything, but unless this kid will sit there and let you do it, it doesn't matter. And kids will get up and run down the hall out the building, and I've seen it before. So again, how can you help after you get down below them on their level, minimal touch, talk to them, then let them see it? Absolutely. Show them what's going to come. They're not going to be afraid. They know what's happening. They feel in control. A multi. You need to do an assessment on an infant and you walk into the room, the infant's asleep in the mother's arms. What are you going to do? What do you think? You need to do an assessment on the infant. When you have a baby asleep, you're not going to be doing head to toe assessment on a child. Remember, I said that last week. And you need to do what you can do when you can do it. An infant who's awake is always cooing and making noise and wiggling, right? It's they're asleep. Number one, I'm going to first look and count respirations. Then I'm going to listen to the heart sounds and the respiratory sounds because the kid's quiet, the kid's asleep. And it's a perfect time. The kid might then wake up. You may not be able to do the rest of it, but you've got heart and respiratory sounds. When do you switch formula to whole milk? And yes, they do need the fat because it has to do with the growth of the central nervous system. And it's at 12 months. We need to still at 6 months continue their being breastfed or formula fed. At 12 months, they can switch to whole milk. A multi. When teaching about car seats for a newborn infant, the only thing you can't do is the old car seat, which is a 10-year-old one. Gently used from a friend, and you know the friend. Rear facing, absolutely, for infants, and then a new car seat always. They do have expiration dates. A multi. When and how do you introduce solid foods to infants? You know, that picture looks like my kids at the end of eating dinner. I used to let them go to town. They used to have so much fun. So you introduce them at 6 months, one food at a time, and wait 4 to 7 days in between. And the reason is we want to make sure they're not allergic to the food that you have just fed them. And it takes 4 to 7 days to understand that. Before assessing a 4-year-old child, what techniques would you use to approach this child? Now, 4-year-old kids are pretty smart, and they know you're a nurse, and they know you probably have a needle somewhere, right? So you're not their friends right now. But you walk in and say, "Oh wow, you got a Batman shirt? That's the coolest ever. Who you like Batman? What do you like about him?" Or, "Oh my God, where'd you get those freckles from?" Or, "You got the biggest blue eyes I've ever seen." "Oh, you've got beautiful bows in your hair." Now, doesn't that make that kid sound like I'm pretty cool now? I'm, of course, down on their level. I am just not touching them, and I'm talking to them. And then I might start talking, playing a little game with them of some sort. So again, distracting them and showing interest in them. How you doing at school? Do you like, gym? Whatever that you can find to talk about. So what technique can be used to examine a toddler? Toddler ages 1 to 3. Again, there's understanding more. Remember, they can't talk as much as they want, but their comprehension is actually pretty good. Smarter than you really realize. And this is the child I would use play. And then we'd be listening to it together. I might even take off my stethoscope and let them listen with me. They can listen to me, I listen to them. Again, we're doing play. It's non-threatening, and I'm getting what I needed to do. I'm getting it done. When assessing a healthy child's lymph nodes, what would you expect? Now, usually you see them in the neck, right? Sometimes underneath the arm, sometimes the groin, but usually here. So if a kid is not sick, what should you expect in those lymph nodes? Shouldn't be able to feel anything. Kids only have lymph nodes that are inflamed when they have an infection. So if they don't have them there, that means they're healthy. So that's what you want to see. Which Erickson stages of developmental levels would be used for a toddler? What did I tell you about toddlers? Who are they? Me, mine, egocentrical, right? And then what's mommy, daddy, and Nana doing? Be careful, don't do that. And it's that autonomy. I'm autonomous. I'm going to do it myself. And you're not going to tell me I can't because you're going to make me feel bad about myself. Like, gee, I guess maybe I couldn't have done that. Well, you need to let them try many times, not all the time. What pain scale would you use on a 3-year-old child? This is the type of question you're going to see on every exam, every HESI, every NCLEX. They love pain scales, and I like to tell you 3. 3 is when it starts faces. Blacks up to the age of 3, okay? And then at age 8, it becomes numeric. Those are those 3 stages that you will see of pain scales, okay? A multi. Erickson's autonomy versus shame and doubt is used to describe toddlers. What does this mean? We want them to try, and we don't want to put them in shame because we don't let them do what they want to do. And toddlers can do a lot more than you can ever give them credit for. So it's only those 3 that we would see with Erickson. A 2-year-old boy is playing with mud and dirt. What type of play is this called? I used to be the 2-year-old girl out there in the mud with my 6 brothers, and I'd come in head to toe in mud. My mother used to be so upset. It's because I love the feeling between my toes and the squishies and all the mud and stuff, right? It sends pleasure. A parent of an 18-month-old boy says that he says no to everything and has rapid mood swings. An 18-month-old, is this the way that they should act? 18 months. Toddler, ages 1 to 3. What do you think? Absolutely normal. You're getting the idea. Good job. What is descriptive of the preschooler's understanding of time? Mommy's coming at 3 o'clock to get you. They only understand after your nap when you wake up, mommy's coming to get you. They don't understand the numbers on the clock yet. Okay? It's with events. When you wake up in the morning, after lunch, after breakfast, whatever. They don't understand numbers, only events. A 4-month-old infant is crying and shaking their head. What feature of pain is this infant showing? And that is the location. It's telling me probably an ear, right? Shaking their head, something's happening there. Like when they put their hands in their mouths, maybe it's their throat. A 1-month-old infant's back of their head is flat. What would you tell mom? Remember, every kid is placed on their back now to go to sleep. I used to love putting my kids on their tummy. Little did I know, right? Remember, put them on tummy time when they're awake. It's going to round out the head. It's going to come back quick. I mean, even little Christian had a flat back of the head. But the tummy time, the kid has a nice rounded head today. So it does work. Infants crawl before they walk. This pattern of growth and development is called what? They crawl before they walk. They lift their head before they roll over, before they get on their knees, before they sit, before they crawl, before they all this stuff. It's a pattern, and it's called sequential trends. It happens in sequences. Very good. How do you communicate with parents that do not speak a language that you know? You know, I was the gringo girl, the all-American girl, who moved to Miami, and now I'm dealt with Haitian and Spanish and many other cultures. How do I speak with them? Well, never with a child, that's older. You should always go through an interpreter, and the reason is another person from that family interpreting could put their own opinion in there, and you only want to know what the parent is telling you. So that blue phone is usually what it's called. What age would most children could understand under, on top of, beside, over, under, around, and back of, all that good stuff? And again, don't think about your own kids and when they did it. It's 4 years old, okay? Yes, Christian was 3 years old. Don't think of your own children as you're looking at these. Those of you who have small children, it is different, okay? The book is different. In terms of language and cognitive development, a 4-year-old child be expected to what? 4-year-old child, the understanding, their cognition, what do they know? This is your preschooler. They don't understand anything but following a command. They don't understand conservation. They don't understand another's perspective. They can have empathy, but they don't understand. An abstract is your adolescence. They can fight their way out of a paper bag. They can figure it out. So simple commands, preschoolers. What pain scale would you use to assess the pain of a toddler? Ages 1 to 3. And then I'll add there, and nonverbal children. It's the FLAC scale. Faces, legs, activity, consolability, and crying. That's what that means. A multi. What safety instructions would you teach the parent of a 6-month-old child? Well, safety. What does a kid do by 6 months old? Think about gross motor. What do? They lift their head up. They turn front to back, back to front. So what is your biggest safety concern now? It's all about rolling around, right? So don't put them on a couch alone. They're going to roll off on the floor. You should cover those outlets because they can go and they can creep in there. And of course, always rear facing until 2. A multi. What are cognitive characteristics of a child ages 2 to 7 in the pre-operational stage? It's part of your magical thinking here is what the answer to this one is. And it's don't know other people and understand their point of view. Oh, they have the empathy. Extremely imaginative, and that's why they'll take a broom and ride around like a horsey, or take something and fly it in the air like an airplane, right? They are using their imagination here. That's part of that pre-operational stage. A nurse receives a phone call about her 6-week-old baby. He's crying a lot. What can she do? The mother's calling about her 6-week-old baby. Crying, 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 crying. What would you tell that mother to do? Well, you have a 6-week-old baby. They have no immune system except mom's. They're high level of risk. They're crying a lot. It may be just formula or burping or whatnot, but you can't determine that over the phone. They must be examined by a physician. They need to come to the doctor, okay? Very important. They're crying that much, they're concerned, they need to come in. It could be something serious. A multi. What should an infant be able to do at 9 months old? What can they do? And this is basically your gross motor skills. They should sit without support at 8 months. That's why sit with support is wrong. No support is needed at 8 months. They can get a rattle, they can pull themselves up, and of course, they can roll over by 6 months. Again, developmental is a lot of information. The first expected fine motor development for an infant begins with what? Remember, fine is fingers. What should they do first? They should have that reflex first. That's the first thing. And then it becomes voluntary. A toddler's parent asked the nurse for suggestions on dealing with temper tantrums. What do you tell them? So you're going to ignore that behavior unless it's going to bring harm to them, okay? Because if you pay attention to it, they're going to continue to have temper tantrums. That's how you get your attention. A 2-year-old has difficulties in activity, sensory sensitivity, and only speaks one-word responses. How are you going to assess what's going on with that child? I mean, it's something you haven't really gone over with yet, but it's something that we have to remember as toddlers. We have all sorts of children in the toddler area. And what we're going to do is the autism check on that child because that is not normal at that point, all of those sensitivities, etc. The parents are concerned her 8-month-old child's not developing like their older child. What's normal for 8 months? What should they be able to do? They should be able to sit alone unsupported. Yes. Pulling themselves up from prone is when we go up to 10 months old. What fine motor skills is expected of a 4-year-old child? A preschooler. Remember, fine as fingers. Remember to read the questions. Fine as fingers, gross as movement. Get up and go, go, go. They should be able to button a shirt. Zipping is movement. Tying shoelaces, that's almost a 6-year-old. Multi. What gross motor skills should a 4-year-old be able to do? Again, a preschooler, what should they be able to do? They should walk upstairs both feet. Tie shoelaces, I told you, that's later on. Hop on one foot. That was a pretty neat thing when Christian started to do it. He thought that was cool. And of course, jumping rope. Good. Orange doing a developmental screening on a 10-month-old should expect which fine motor skills from the infant? Remember the question, what are we looking for? We should be able to grasp a rattle and we should be able to use that pincer grasp. And it's, maybe still a little crude, but it should be almost fine at this point. Frequent developmental assessments are important for what reason? Why do we need to know when they turn over and stand up and do all those things? Why? Because, when they're not doing what they're supposed to do, that means there's a problem. And we need to, go back and find out why. And as I've said, children are amazing and resilient. Early intervention, speech, physical, occupational therapy catches them up really quick. And you want to get them caught up as quick as possible. An infant searches for her toy that's not in sight. What is this? That's a multi-select. Not there, but I know it's there, right? Object permanence is another way of looking at this question. It's because they remember it's there. And now that exploration by themselves or moving muscles is all really great. And again, object permanence, of course. The natural physical developmental sequence that most children follow is what? What do you do first? Physical is another word for gross motor. What do you do physically? And the first thing you do is you lift your head, so the rest goes along with that. A multi. What would alert the nurse to hold digoxin on an infant she's caring for? So remember, digoxin is an old drug. We treat it just like an adult drug, but we have to look at it as an infant, not as an adult. When would you hold it on an adult? Well, the heart rate's too low. That's number one. But on an adult, the dig level's too high, potassium level's low. You're not going to give it. And it has nothing to do with pulses. So those are some questions you might see related to vital signs. In general, an infant should triple their birth weight at about what months of age? Triple. When do you do that? Born at 7 pounds, triple 21 pounds at 1 year. Yes. Double at 6 months. When an infant's toes spread when the soles of their feet are stroked, that's called. And that's Babinski. Good job. Just like adults, no different. How can you prevent otitis media in infants? And it's all about smoke, believe it or not. I mean, breastfeeding always helps, but smoke does a lot of damage in many ways to newborns. When entering an infant's room, the door slams shut and the infant jerks, starts to cry. What is that reflex called? Because children have reflexes. Babinski, we've already talked about that one. It's called moral or startle reflex. So all of a sudden they'll come up like that. Rooting is when you stroke their chin and they go looking for something to eat, whether breast or bottle. A 4-year-old is reluctant to take medication. What intervention should the nurse take? Now remember, preschoolers are pretty smart. And at home, if mommy hasn't made them take it, it's not really, you're going to do it too. So, what can you do to make it, yeah, you're going to take it? It's a straightforward approach, as in, do you want liquid or a pill? Do you want it in a cup or do you want it in a spoon? If you mix it with food or juice generally, if they don't eat all the food or all the juice, how much medicine do they take? Now, sometimes a small little teaspoon of it, okay, but not generally with food or juice. So it's that, how do you want? You want the pill, you want the red one, you want the orange one. And that's the only choices you give them. Which intervention helps a hospitalized toddler feel a sense of control? Excuse me. Remember, toddlers, these are really, I think, the most difficult, and it's the routine. Very good. That, keep mommy with them. A 3-month-old infant does not sleep through the night. What finding is most significant? Why wouldn't a 3-month-old sleep through the night? They should sleep about 6 hours minimum. And this is the one, if they're not sleeping, first of all, do they have a diaper rash? You know, and then you go and check everything out, but it's the diaper rash here. An RN is assessing a 2.5-year-old toddler. What findings should you report to the provider? Which one of these is not right? And that's the head and the chest. Remember, by 15 months latest, the head and the chest should be at least the same. The head is bigger at birth, and then it equals out, and the chest becomes more. A multi. What are risk factors for SIDS? Everything breastfeeding decreases the risk, so everything else. Smoke again there. What does the rooting reflex enable the infant to do? What's a rooting reflex? And that's to be fed. You go, ooh, and I want to eat, and they go right towards it. A multi. A child's been admitted with profuse diarrhea for 2 days. What would you expect? Now, on the HESI, one of them recent had 4 different acid-based questions. And I tried to throw this into the lecture where it should be so that you're trying to understand and remember. Well, if you're losing fluid, you're losing potassium for sure. We know diarrhea has a lot of alkaline substance because of the enzymes which digest food. So you're losing alkaline. What is left? Acid. So that's metabolic acidosis. If I was vomiting, I'm losing stomach acid. I'd be left with metabolic alkalosis. Trying to make that easy for you. Normal language skills for a 3-year-old child. They should be in about 4-word sentences now. They're pretty good. They're pretty smart. An infant's unable to take breast or bottle for feedings. What's important to remember? I mean, some children are born and they just, due to their condition, cannot feed in the mouth. And we still have to remember growth and development, right? So what do we need to do? Think about, what does the mouth provide an infant and children? It's how they self-soothe, right? We need to offer them a pacifier. And it helps so that they can self-soothe, and it keeps them calm, and it decreases stress. That, I mean, years ago, pacifier, yes, no, I mean, I've heard always, but they've realized this is how they self-soothe. Give them a pacifier. And we'll get into some conditions that we'd have to use that. And last question. What does an infant start to do at 3 months? And they should be actually lifting their head up. They don't roll it over yet. That's a wrong keyed question. It is lift their head up. They roll over from their abdomen to back at 5 months and back to abdomen at 6 months. Sorry, that was wrongly keyed. Number 3, an AK. There's an AC. Sierra, good job, Sierra. Number 1, did you do it again? Turbo, good job, Turbo. Number 4, Will and Lizbeth. Good job, guys. So next, remember this week you have a discussion question that's due. I haven't scored the ones from last week yet. I'll be doing that again tomorrow just to let you know. If you need anything, you let me know and I will get back with you. You guys have been good with communication. Any questions, comments, concerns? Good night, guys. Thank you for a good class.